Good evening, everyone, and greetings from Mirror Health. And we have hosted this special Zoom meeting to commemorate the World Mental Health Day. And this was celebrated on the 10th of October. But considering that we are still in October, we wanted to celebrate it today. And basically, we realized the importance of mental health issues, which can complicate women and more so during pregnancy and the postpartum period. So, to actually spread the awareness of how important it is to look after the mental health of the women in this age group or women in general, we've got this program structured. So the best part is we have a psychiatrist, neuropsychiatrist who is going to address you all on the importance of what these mental health issues can be during pregnancy and beyond, because the woman is dynamically changing. She is a girl, then becomes an adolescent, and then she becomes a mother. Then there is this perimenopausal period, and then the menopause, and all these things happening in her body, which she has to kind of tackle. So, keeping all this in mind, um, I would request before we start the panel discussion, which is going to be dedicated to high risk pregnancy problems in general, and how we can actually counter it in general terms, not necessarily scientific in the scientific language. So I would request Shrikant from the admin team to play the video, which is actually given to us by Dr. Madhusudan Srinivasan, who's a psychiatrist and who is our collaborator for psychiatry and mental health issues at Mirror Health. So, okay, fine. So I think the video is here. Let me share my screen.
Hi everybody, I'm Dr. Madhusudan, a psychiatrist.
Are you all able to hear?
Today I'll be talking to you about the topic mental health in pregnancy and the postpartum period. By postpartum period, we mean after childbirth. I would like to elaborate on the following topics here. Mainly, there are certain normal psychological changes which many pregnant women experience. I would just like to elaborate on that. And then there are these psychological disorders which start off during pregnancy. So we'll know more about it. And then management of certain pre-existing psychological disorders. The woman may have a pre-existing psychological condition. So during pregnancy, what do we need to do about it? And briefly about infertility, its treatment, and the psychological disorders that may be associated with it. Then the other major part would be I'll talk about psychological disorders after childbirth. So then there is a mild condition known as postpartum blues. The other uh, disorders like postpartum depression, psychosis, these are quite severe and require attention. I'll also talk about management of these conditions and breastfeeding because that's another concern. What impact the treatments will have on the infant. Now, with regard to mental state changes, which can be experienced by most pregnant women. For example, there could be anxiety about baby's health, the individual's own health, and about labor also. And then there could be feelings of sadness. This could be related to some of the physical symptoms that one experiences, especially during the first trimester. It could be feeling excessively tired, constantly throwing up. So this could manifest as breaking into tears for no reason, restlessness, and irritability. There is also a concern that the body is losing shape as there is weight gain. And then there could be sleep issues. Providers with whom one is on a regular consultation. That alone should have. But however, if there are particular symptoms, which indicate an anxiety disorder, that one needs to be aware of and seek help immediately. For example, persistent worrying thoughts that do not subside, that do not go away after a while, or even with reassurance. Then constantly feeling restless, irritable, or on edge. One could experience panic attacks. These are wherein there is intense fear experienced by the individual, as well as certain physical symptoms like palpitations, tremulousness, excessive sweating, feeling giddy, so even breathlessness. So these indicate panic attacks. So if one is experiencing that on a frequent basis, that also needs to be uh, considered as a criteria for an anxiety disorder. Then it could be associated with persistent sleep disturbance. Along with this, I would also want to highlight the symptoms of a depressive disorder could be vis-a-vis certain normal psychological changes that we refer to. Usually, these symptoms persist over a period of about 2 weeks. They could be constantly feeling sad, moody, irritable, associated with crying spells. There could be decreased appetite, even when there is no nausea. This we need to distinguish because most women may experience such symptoms in the early period of pregnancy. Then it is associated with disturbed sleep. One feels exhausted almost always. There is agitation, restless feelings. There could be thoughts about worthlessness, guilty feelings, and most importantly, loss of interest in hobbies and favorite activities. One does not enjoy the day to day routines that they were previously carrying out. They may find it hard to concentrate on routine tasks. There could be feelings of helplessness, hopelessness, or thoughts of wanting to commit suicide. So, this is a psychiatric emergency which one has to immediately consult. So, if one is experiencing these symptoms, these are suggestive. I mentioned initially about anxiety disorder or depressive disorder. It's advisable to consult and seek treatment. The main aspect here I would want to highlight is there are effective medications, treatments available which are relatively safe during pregnancy, which could be administered along with, usually we use a high dose folic acid supplementation. This is to prevent developmental defects in the child. Other treatments apart from medicines that are available, depending on the severity of the symptoms, are ECTs, what we refer to as electroconvulsive therapy. In fact, one may sort of feel whether it is safe during pregnancy. In fact, it's a treatment of choice sometimes. And of course, psychotherapy, counseling. This is one of the treatment modalities that needs to be carried on side by side along with medical treatments. On similar lines, if the expected mother has pre-existing psychological conditions, especially severe mental illnesses like psychosis, major depression, or obsessive compulsive disorder, it is preferable to consult the psychiatrist to find out shifting to medications which are relatively safe during pregnancy. And we need to start with folic acid supplementation around the time of conception. I would want to highlight that it is not mandatory that we stop all medicines, psychiatry-related medicines, before conception. I would just like to briefly allude to infertility and its psychological impact. So, an individual or a couple experiencing infertility, there will be a lot of issues that they go through. I would like to talk about anger with self for the failure of one's body to procreate, which in turn could lead to a decrease in sexual desire. The couples feel socially excluded, negatively stigmatized. There could be profound sadness and grief with each returning menstrual cycle. Treatments are being carried out, but the mother has not conceived. So, and the other aspect is treatments involve significant sacrifice of time. One has to go through the whole process, and privacy issues and money, financial aspects, with no guarantee of conception or successful birth. This can be quite disempowering, stressful, and frustrating. So these aspects need to be dealt with side by side to motivate the individuals as they go through sometimes quite a long drawn process of infertility. And sometimes, obviously, it could be successful in a short duration of time. That's also a favorable outcome. I would also want to talk about certain psychological illnesses, which have already referred to anxiety disorders, depression, which are seen quite frequently in individuals, women experiencing infertility. Up to 40% of such individuals who seek infertility, they may experience such symptoms. For example, generalized anxiety disorder, major depression, and there is an increased risk of suicide also. So there are certain psychological triggers wanting to conform to social expectation by becoming a parent, loss of sexual desire and enjoyment, fear of advancing age and financial concerns. Usually these symptoms, these disorders are seen to peak 4 to 6 years after the treatments for infertility have been started. And here medications, some of the medications that are used to treat infertility, they could contribute to symptoms of anxiety, depression, and irritability. That said, some medications used to treat psychological disorders could also contribute to infertility. So management of psychological impact of infertility and its treatments include psychotherapy and medications where indicated. I'll come to the other major part of my talk today. It's about psychological disorders after childbirth, what we refer to as postpartum psychiatric disorders. Most women, they feel low or tired a week or two after childbirth. So these we refer to as baby blues or postpartum blues. They usually get better on their own. For some, feelings of sadness persist longer, makes them lethargic, unable to care for baby. Other criteria for a depressive syndrome, which I have already referred to, they would also meet those criteria when we need to diagnose a depressive disorder. And there may be thoughts about harming oneself or the baby. This needs consultation and treatment. And then anxiety disorders. Generally, anxiety about baby's well-being is common, but when it is intense, we have to assess for an anxiety disorder. Then there could be body image issues, feeling fat and unattractive. And there is a natural comparison today with social media, with celebrities and friends who may have lost weight faster. Usually, weight loss may happen over months. So each individual is unique here that we need to bear in mind. Then there could be sleep issues also, especially feeding the newborn, which could be at even during nights, leading to sleep disturbance. So to practice certain simple techniques like deep breathing or muscle relaxation exercises should help promote sleep. And of course, to involve their spouse in caring for the baby. Another important condition that I would like to highlight here is what is known as postpartum psychosis, which is quite a rare condition, but it's quite severe. 1 or 2 women in 1,000 may experience this, which has symptoms like extreme confusion, excessive energy, the person is agitated, and there is associated sleep disturbance, rapid changes in mood, and distrusting other people, seeing things or hearing voices that are not there, thoughts about hurting oneself, the baby, or even others. So, identifying above conditions in the postpartum period at the earliest and instituting treatments is advisable. Again, there are medicines which are safe during pregnancy, which could be administered, and we could ensure recovery. So with this, I would want to end with a take-home message. What I would want to say is early identification of psychological illnesses during pregnancy and after childbirth and during infertility treatments will lead to better outcomes and ensure mother and child well-being. The benefits of treatments far outweigh the side effects. This we need to bear in mind. Thanks for listening. Thanks to Mirror Health and Dr. Revati Madam for giving me this opportunity to talk.
So I think that was a great talk by Dr. Madhusudan, and it was a very focused talk. It is very difficult to identify, let me tell you, as an individual and as a provider, that's a doctor, it's very difficult for us to identify psychiatric disorders at the initial phases. There's a thin line between normalcy and abnormal behavior. So unless we are aware that these things can happen and these things can affect our pregnant mothers and mothers who have delivered, most of them go into greater states of depression and irreversibility. So it is very, very important that we identify these problems. And sometimes it can also lead to abnormal outcomes, like, for instance, a mother may decide to kill herself or kill the baby, and these kinds of traumatic outcomes can occur unless and until we are aware that these individuals require some kind of counseling, support, medications. And the acceptability that these things can exist is also very, very important. There should not be any social stigma attached to it. The family should be absolutely supportive of this whole thing. ಸೊ ಕನ್ನಡದಲ್ಲಿ ಹೇಳ್ಬೇಕಾದ್ರೆ ಮಗು ಹುಟ್ಟಿದ ಮೇಲೆ ಎಷ್ಟೋ ತರ ಒಂದು ಸೈಕಲಾಜಿಕಲ್ ಇಶ್ಯೂಸ್ನ ಅಮ್ಮ ಮತ್ತೆ ಅಮ್ಮ ಫೇಸ್ ಮಾಡ್ತಾಳೆ. ಅಂದ್ರೆ ಅವಳಿಗೆ ಬಾಡಿಲಿ ಚೇಂಜಸ್ ಇಂದ ಎಷ್ಟೋ ಜನಕ್ಕೆ ಮೆಡಿಕಲ್ ಇಶ್ಯೂಸ್ ಇಂದ ತುಂಬಾ ಸ್ಟ್ರೆಸ್ ಆಗಿ ಕೆಲವ್ರಿಗೆ ಬಿಕಾಸ್ ಆಫ್ ಸಮ್ ಹಾರ್ಮೋನಲ್ ಇಶ್ಯೂಸ್ ದೇ ಮೇ ಕಂಟಿನ್ಯೂ ಟು ರಿಮೇನ್ a little on the negative side, ಸ್ವಲ್ಪ ಡಿಪ್ರೆಷನ್ ಹೋಗ್ಬೋದು. ಆ ತರ ಸಿಚುವೇಶನ್ ಅಲ್ಲಿ ನಾವು ಕರೆಕ್ಟ್ ಆಗಿ ಸಪೋರ್ಟ್ ಮಾಡಿ ಅವ್ರಿಗೆ ಏನ್ ತರ ಹೆಲ್ಪ್ ಬೇಕೋ ಅದನ್ನ ನಾವು ಪ್ರೊವೈಡ್ ಮಾಡಬೇಕು. ಸೊ with this, I would want to say a few quotes just before we start our wonderful panel with our wonderful panelists. So taking care of your mental health is an act of self-love. So it is very, very important that you take care of your mental health. Your mental health is just as important as your physical health. Healing doesn't mean the damage never existed. It means the damage no longer controls our lives. This is very important. So there could have been an issue, but if you have actually healed from inside, so that would be an enlightening experience. That's how you actually get progressive about the problem, in the sense you would positively heal that situation so that you get better and you get more stronger. So before I move on to the next set of quotes, we have a dedicated panel, not restricting to mental health, but high risk pregnancy in general. So we have our wonderful panelists, and they are in different walks of life, and I'm so glad to have been associated with them during their pregnancy journeys. And they are here as uh, motivators, and I think they are going to share their inspiring journeys so that this will add value to all those women who are aspiring to get pregnant and who want to probably pursue this journey in a very positive way. So I welcome Mrs. Aishwarya Jagannathan. Can you please introduce yourself, Aishwarya? Please turn on your video and say one or two lines about yourself before we move on to the panel.
Hi, everybody. Good morning. Good evening, doctor. It was nice to have this discussion. I'm Aishwarya. I've been associated with Dr. Revati since 2010. So my association with her has been a very really enriching one, to say. So she's helped me in both of my pregnancies. And now I have two lovely daughters, and I'm enjoying my life.
And now she's come to share her inspiring journey so that, maybe there can be take home messages for those aspiring mothers to have a healthy and a positive pregnancy experience. Next, I welcome Mrs. Kavya Raja. Kavya, are you there?
Yes, doctor, I'm there.
Yes, so wonderful. So Kavya, can you please introduce yourself in one or two lines?
Yeah, warm welcome to all of one and a very good evening, doctor. So how about you? Everyone are doing good, I think. So even I'm also doing well. So the thing is, like Dr. Revati, she has helped me a lot and lot. I was in a situation, and I was every young ladies are very anxious to get pregnant. Even I was the one who was very anxious to get pregnant, but Dr. Revati has given me a lot of confidence, and because of which I gave a birth to a lovely daughter, and whatever her name, I think Dr. Revati, it starts from R. So I have kept the same name to my daughter. So it also starts from R, and her name is Raghavi. And today she's there it is only because Dr. Revati, that is you. Thank you, doctor, for each and everything. And yeah, that's it, doctor.
What do you do, Kavya? What do you do, Kavya? That's important.
Yeah, I'm working in Infosys as a technical lead, and I was like, even we are talking about the postpartum, right? So even every ladies has a postpartum depression, wherein every ladies they like the body weight increases and some body weight decreases, and there'll be a huge change in body weight as well. But one thing, ladies, don't ever give up. Just keep on trying and leave for your child. And one more thing, I just request every every husband has to be gone through the counseling, and they have to be given a counseling to them so that they understand their wife mentality. So once all the ladies mentality is very strong, and definitely the postpartum depression will just come down, because even I was under the postpartum depression, wherein my family, the whole family, helped me out to come out.
I'll come back to you, Kavya. I'll come back to you with a specific question. So I think Kavya is a technical lead from Infosys, and I delivered her about 8 years ago, and she will answer specific questions so that people will be kind of getting focused answers. Then we have, do we have Rashmi Vinay? Okay. Can we call Rashmi Vinay, please? Rashmi, are you there? Can you unmute yourself?
Yeah, hello, doctor. Yeah, good evening, everyone.
Can you just briefly say 2 lines about yourself before I ask you specific questions?
Sure, doctor. Hi, everyone. This is Rashmi. I've been working as a software engineer. I've been blessed with two twin girls. I think the major reason behind that is Dr. Revati, ma'am, I would say. Okay. And I had a lot of complications, but however, with Dr. Revati's guidance, I think all went well. And finally, with the third IVF cycle, I think it became a huge success. Okay. But thank you so much
much,
for
Rashmi.
inviting me to this
Yes.
the program. Yeah.
So yeah, we're going to come back to you with a specific question. Then we have Deep Lakshmi Sangavkar. Is Deep Lakshmi there?
Yeah, ma'am, I'm there.
Yes, so nice. So we have women from different walks of life. So she is not a software person, isn't it? She's a finance professional. So Deep Lakshmi, so
Yeah,
very
hi,
nice
ma'am.
to
I'm
have
on
you
my
with
way
us.
to. Yeah,
Very
I'm
nice.
I'm on my way to Kaban Park, but yes,
okay.
the location is also good, and fortunately this time I'm really on the way of mental well-being. So
Yes.
yeah, hi
So,
everyone.
and Deep Lakshmi, I delivered her son long ago, and now she started a new pregnancy journey for which, we've just started working on. So thank you so much for joining in. She's a finance professional and an active question asker, I should ask. She, Rashmi, and everybody used to ask me plenty of questions. Very, very inquisitive and very diligent. Thank you, Deep Lakshmi. I'll come back to you with questions.
Thanks, ma'am.
Then we
Yeah.
have Ramanamma. Ramanamma, nam clinical ivaga. So Ramanamma is my very old acquaintance. I delivered her in 2015. And she had a visit today and she made sure that she joins the Zoom from the clinic up, after giving her blood test. Thank you so much, Ramanamma. ಸೊ ಇವಾಗ ನಿಮ್ಗೆ ಕೆಲವು ಕ್ವೆಶ್ಚನ್ಸ್ ಕೇಳ್ತೀವಿ ನಿಮ್ ಬಗ್ಗೆ ಒಂದೆರಡು ಮಾತು ಹೇಳಿ ಆಮೇಲೆ ನಾವು ನಿಮ್ಗೆ ಸ್ಪೆಸಿಫಿಕ್ ಕ್ವೆಶ್ಚನ್ಸ್ ಕೇಳ್ತೀವಿ ಅದ್ರ ಬಗ್ಗೆ ನೀವು ಮಾತಾಡ್ಬೇಕಾಗತ್ತೆ ಆಯ್ತಾ ಏನ್ ಮಾಡ್ತೀರಾ ರಮಣಮ್ಮ
ನಾನ್ ಸ್ಟೇಟ್ ಗೌರ್ಮೆಂಟ್ ಎಂಪ್ಲಾಯಿ ಸೀನಿಯರ್ ಅಸಿಸ್ಟೆಂಟ್ ಆಗಿದ್ದೀನಿ ಆಫೀಸ್ ವರ್ಕ್ ಮಾಡ್ತೀನಿ ಸ್ಟೇಟ್ ಗೌರ್ಮೆಂಟ್
ವೆರಿ ಗುಡ್ ಸೊ ನಿಮ್ ಮಗಳಿಗೆ 9 ವರ್ಷ ಆಯ್ತಾ
9 ವರ್ಷ ಆಯ್ತು ಈಗ 2015 ಅಲ್ಲಿ ಡೆಲಿವರಿ ಆಯ್ತು
Okay, so I delivered her in 2015 and she's a very active young girl. So ನಿಮ್ಮ ಹತ್ರ ತಿರ್ಗಾ ವಾಪಸ್ ಬರ್ತೀವಿ ರಮಣಮ್ಮ ಅಂಜು ಕೃಷ್ಣನ್ are you there Anju?
Yes, madam.
Yes,
Yes.
so we have another mother to be, Anju. Thank you so much for joining in. And Anju, can you just show yourself and say briefly about yourself so that we can probably start with the panel? Can you introduce yourself? Where are you from and what do you do?
I work with Canara Bank. Actually, my first trimester is going on. And
you're a bank official, right? Okay.
Yes.
Yes. So she is basically from, you're from Bangalore only, no, Anju?
No, I'm from Kerala.
Kerala. Okay, fine. So she is my new pregnancy recruit, a very active, thank you for participating in this wonderful panel. So I think we have women from various walks of life who have taken part in this discussion. So let me just ask these questions and then talk to you all from a doctor's perspective after hearing your wise words, because I have to first of all congratulate all of you because all of you are champions, most of you who have already delivered and the others who are starting their pregnancy journey. And I'm sure you've done quite a lot of hard work to get to where you are right now. So if I have to ask, I will be asking these questions to two people at one shot. So I will first be calling Aishwarya as well as maybe Kavya. No, Aishwarya as well as who's the next person? Anju. So if I have to ask you this question, planning a pregnancy, what is the role of preconceptional evaluation? Aishwarya, do you feel it is important that couples should plan their journey